Okay, welcome to Understanding the Opioid Crisis. Where do I begin? My name is Brian Leach, and I'm representing the NNLM South Central region. Here are my disclosures. Any mention of any commercial brands are purely incidental. I'm not promoting any particular product today. So, you might remember this article from 3 years ago. The then adult teen librarian from the Free Library of Philadelphia, Chair Kowalski, was featured in national media as an example of library staff who've had to administer Naloxone to people who are overdosing on drugs. Like parks and other community centers, libraries are proximal or sometimes the site of fatal overdoses. And while being trained on the use of Naloxone, sometimes called by its brand name Narcan, is not necessarily something that was taught in library school or whatever professional program you were in, it's important to recognize all aspects of what it means to work in the community. An estimated 1.9 million people in the U.S. have a prescription opioid use disorder, while another 586,000 have a heroin use disorder. Numbers that large tend to be abstract. So just to give you an idea of how large that is, if the number of people with prescription opioid use disorder formed their own city, it would be the 6th most populous city in the U.S., just below Houston, Texas, but larger than Phoenix, Arizona, which is what's pictured here, and incidentally, my hometown. And then the city full of those with a heroin use disorder would be between the size of Albuquerque, New Mexico, and Milwaukee. So this is going to be a little interactive. So quick audience poll. So I just gave you a couple numbers here, but according to the CDC, how many Americans have used illegal drugs or misused prescription drugs? Go ahead and put your answer into the chat. Okay, great. So many of you picked C, a few G's and A's. According to the CDC, it's 48.5 million Americans that have used illicit drugs or misused prescription drugs, according to the CDC. That's 1 in every 7 Americans. But there are a variety of factors that contribute to this. And today we're going to gain a greater understanding of the issues and resources around opioid misuse, including why we call it opioid misuse. That can help you better serve your patrons and potentially support future programming or partnerships to help address opioid misuse in your community. And like I said, I'd of course love to learn what you're already doing. Many of you are already doing some fantastic programming or have some expertise in this area. And I encourage you to share your knowledge and ask questions in the chat throughout the hour. I'll be monitoring it frequently, and there may be time for Q&A at the end. The CDC describes the opioid crisis in terms of waves. The first modern wave of the opioid epidemic, or an increase of deaths due to opioid misuse, started in the late 90s. Pharmaceutical companies had reassured the medical community that patients would not become addicted to prescription opioid pain relievers, and health care providers began to prescribe them at greater rates. Then in 2010, there was a second wave with an increase in heroin deaths. And then the third wave began in 2013 with a significant increase in synthetic, that is lab-created opioids, such as fentanyl. It's relatively cheap and easy to manufacture, and many other drugs like cocaine are often laced with them. However, it's highly potent. In fact, using data from the National Vital Statistics System, I guess the second resource I've mentioned of the day, researchers found that the involvement of fentanyl in opioid overdose deaths rose from 14.3% in 2010 to 46% in 2016. One academic associates the resurgence in attention to the opioid epidemic in the media with Philip Seymour Hoffman's death in 2014. In any case, the number of overdose deaths involving opioids, both prescription or illegal, was 6 times higher in 2017 than in 1999. More than 700,000 people have died from an overdose during that time. That's almost the population of Washington, D.C. I've used a number of terms that I would like to define now. What are opioids? Essentially, they are a class of drugs used to reduce pain. More specifically, they are natural, synthetic, or semi-synthetic chemicals that interact with opioid receptors on nerve cells or neurons in the body and brain and reduce the intensity of pain signals and feelings of pain while simultaneously increasing pleasure. There are legal drugs like oxycodone, sometimes known as Percocet, hydrocodone, sometimes known as Vicodin, its brand name, and morphine. And then there are illegal drugs like heroin. Natural opioids are, as the name suggests, they are naturally occurring substances extracted from the seed pod of certain varieties of poppy plants. These include morphine and codeine. Synthetic drugs are exactly what they sound like. They were developed in a lab and target the same receptors as natural opiates. These include drugs like fentanyl and tramadol. Semi-synthetic drugs are created in the laboratory but derived from natural opiates and include drugs like oxycodone and hydrocodone. An overdose, which occurs when the amount of drugs in one system is excessive to the point that it disrupts bodily function. So I mentioned Naloxone earlier with that librarian from the Free Library of Philadelphia who had to administer Naloxone multiple times. It's what's known as an opioid antagonist as opposed to agonist, which means it binds opioid receptors and reverses or blocks the effect of other opioids and helps restore normal function. Unlike opioids, though, which does not decrease pain or increase pleasure. So the last place I lived, or a place I lived for several years, was Columbus, Ohio. And if you're familiar with it at all, it's well known as a resident that there is an opioid issue there. Just before I moved away from Columbus, Ohio in 2016, this news, this was something that occurred. 27 opioid overdoses in 24 hours. And unfortunately, this is something that has happened more than once, at least in Columbus, Ohio, since I tracked the news there a little bit. It feels like every other year something like this happens. And as a result, harm reduction experts in Ohio have recommended, and probably beyond that, that users carry naloxone on them. Because even if the overdose isn't from something like heroin, which we know is an opioid, maybe it's with cocaine, which is a stimulant, it's because fentanyl, which I mentioned earlier, is a synthetic opioid, is something that's often laced into cocaine and other drugs. So experts recommend that people carry naloxone on them. Just a little side tidbit there. So I want to, again, this is really just an overview of a lot of different concepts. I do not claim to be an expert in addiction, but I just want to describe it a little bit for context. So the concept of reward is a central characteristic to many addictive drugs. As I mentioned, they reduce pain while simultaneously increasing pleasure. The neurobiology can be a bit complex, but suffice to say, use of these drugs increases people's tolerance and dependence on opioids. And as their effectiveness decreases over time, people then need to take more drugs for the same effect, and that desire for reward becomes an overriding motivation for people. And then over time, or even sooner, depending on a person's predisposition, it can literally change brain circuits or the hardware of the brain to the point where if someone tries to go cold turkey without medically assisted treatment, they may likely die because their body doesn't function naturally anymore. Medically assisted treatment, or MAT, has shown to lead to better outcomes for those with opioid use disorder. While it might not be the best for every individual, it's a generally good intervention especially when paired with counseling, which is pretty standard. Medically assisted treatment decreases the risk of relapsing, preventing the spread of infectious diseases like HIV, and prevents overdoses. You may be familiar with methadone or methadone clinics. We're going to talk about Stigma in a second. But methadone, buprenorphine, naloxone, and naltrexone are the major opioids used in medically assisted treatment. And yes, in a way, it is trading one opioid for another, but the data shows that this trade results in, when successful, returning to a productive life. Okay, before we get into resources, I just want to discuss one more thing, and that is the language people use when talking about opioids and addiction. In the past, and even today, people use the word junkie, crackhead, and other negative terms, labeling the person and not the behavior. But it can really negatively impact those who have an opioid use disorder. It creates a stigma which increases barriers to treatment. Those who hold negative and untrue beliefs are likely to resist implementation of new addiction treatment programs, syringe services programs, overdose prevention sites, etc., in their community despite the evidence. It can also impact the quality of care that a healthcare provider gives if they have a negative perception of their patients. And then those who do suffer from opioid misuse disorder are less willing to attend treatment and take advantage of access to healthcare or even have access to healthcare. They suffer from lower self-esteem and mental health, and they're less likely to go into harm reduction programs, or take advantage of interventions like needle exchanges, substitution therapies, like I mentioned, medically assisted treatment, or safe drug consumption rooms that are designed to decrease the risk associated with drug use, such as infected needles. By the way, some in the community or your community may oppose programs like these because they feel it enables drug use. But there's plenty of evidence and data showing that all of these things actually decrease use. I really like this quote here. Words are important. If you want to care for something, you call it a flower. If you want to kill something, you call it a weed. How we label things frames and informs how we're going to treat things, or treat people in this case, even if we have evidence to the contrary. So it's really important to use person-first language. And actually, on that note, I do want to share a resource that I did not include in these slides, but it comes from the National Institute on Drug Abuse. Go ahead and copy and paste that. So it's a page. It's called Words Matter, Terms to Use and Avoid When Talking About Addiction. So it talks a little bit more about stigma and what we should keep in mind. And what I really like about it is that it has a chart of terms to avoid, terms to use, and why. So, for instance, it says instead of addict or user or junkie or drunk, so this is really covering a wide variety of substances. use words like person with substance use disorder, person with opioid use disorder, patient. And this type of terminology is used because it has that person first language. It shows that a person has a problem rather than is the problem. And it avoids illicit negative association, punitive attitudes, and individual blame. And so I encourage you to explore this resource after this presentation. And just a little bit more, I never actually defined misuse, but it refers to when you don't use a drug as medically intended. This could be when you're taking it regularly due to an addiction or use of an illegal substance, but this also refers to not following prescription instructions. Or it could be when a person shares their prescription medicine with a family member. In in-person version of this class, sometimes I've asked people if they, ever keep medication or pills in a bag, and more often than not, more than half of the room raise their hands, or sometimes they even show me. I am not asking any of you to do that, but those are examples of misuse as well. And I like to use this example because it's really tempting to invoke a stereotype by calling someone an addict, or many of the other terms that I described earlier. And that tends to bring up imagery of shady individuals, but it's complicated, as demonstrated by this article. The older adult population. We know that most people past a certain age have 2 or more chronic diseases that they have multiple prescriptions for. We also know that it's really easy to lose track when you're also suffering from other functional disabilities like vision issues or generally poor medication management. There are issues that don't just affect older adults, but affect the population, at least Americans across the nation. For instance, health literacy and our ability to read instructions. But with an aging population, which includes many of our loved ones, and eventually us someday, if we're not already there, it's no wonder that addiction among the elderly is becoming a problem. And this is also part of the opioid crisis. And with the stigma around drugs, that might be more so with the elderly population or others. So for those that, don't, again, going back to stigma and stereotypes, no one wants to consider themselves someone who's an addict or a junkie or many of these other labels. And will they seek the help that they need? And what about other populations? I don't know these answers, but I can at least share this information and also share resources that might aid you in future programming that you might do. Okay, so many of you may already be familiar with this, but the resource you are looking at now is Medline Plus, which I like to consider essentially the flagship consumer health resource of the National Library of Medicine. Whenever I'm working with patrons, I always tell them that if you remember only 3 things from this presentation, I hope it's one of them. Medline Plus is an online health information resource. You may be familiar of many popular ones that are available on the internet, but Medline Plus has no advertisements or endorsements. It's available in multiple languages and it's reviewed regularly. If I'm working with patrons, I tell them, and it's true, whenever I have a health-related question, I will include Medline Plus as a keyword, like flu, Medline Plus, or mosquito bite, Medline Plus. Inadvertently, whenever people do that, even if they don't remember the exact name of the resource, that will be one of the first results that comes out in their Google or Yahoo search. Redline Plus has over 1,000 topic pages, and this is sort of the top of one. This is on drug use and addiction. Each topic page usually summarizes the issue at hand, as you can see here. As you can see on the right, it also links to other related health topics. What I really like to show people a lot are all the different links and resources that's usually on the bottom half of any given topic page. If you're just looking to learn a little bit more about opioid use or opioid use misuse disorder, there are plenty of resources for that. If you're a researcher and you're trying to find data or you're trying to find journal articles about a certain topic, there's a section for that. I know that this list continues to go on beyond what I have shown here. Another hallmark of the trustworthiness of Medline Plus is that it's also used by many hospitals and medical centers around the nation to provide handouts to patients. So it's linked into their electronic health record system. So ultimately, it's one of the most trusted consumer health sites around. While Dr. Google gets better and better every year, I often tell patrons or other audiences that Medline Plus is something that you can depend on. Furthermore, your local NNLM regional medical library is your connection to Medline Plus. If you have any feedback or questions about the product itself, staff like myself can pass that information on to the National Library of Medicine. The next resource I want to show you is Drug Information Portal. It's exactly what it sounds like. It has information on over 84,000 drugs, even those that are still going through clinical trials and are not yet available. You can search by brand name or their generic name, like Narcan, or its generic name, Naloxone, rather, the treatment that's used to reverse the effects of opioids. And it's not just for those who are suffering from overdose. Naloxone is also something that's used in post-surgery. This portal, like Medline Plus, provides links to many other authoritative drug resources like scientific journals. If you can see the button in the sort of top right here, you can actually view the chemical structure of any given drug. You can view synonyms. And it also has additional resources from other authoritative sites. DailyMAD is another resource from the National Library of Medicine. It is a database of drug information labels from the FDA for all drugs sold in the United States. You never have to keep those tiny papers with the ultra small text anymore. The site makes for easy reading and learning about the proper way to take medication and possible drug interactions. It might also make a good resource if you're having trouble sleeping, but that is not an official message. I think this is a rather easy resource to promote among your patrons or other audiences. I think about older adults a lot. I have a real passion for serving the elderly, and as I mentioned earlier, many adults have 2 or more chronic diseases, and the elderly population is booming right now. So I think resources like this, are going to be a little bit easier to promote, and there are lots of ways to do that. Okay, so here's just a record for buprenorphine and naloxone. This combination is often used for medically assisted treatments as well. As you can see, this is a much friendlier site than again, the little tiny folded papers that you find in prescription drug boxes. Okay, this next one isn't a resource per se, but I think it does. It could be interesting if you have a large space or public foyer, and if you are entertaining the public. I know that's not the case for many institutions right now. But the National Library of Medicine has a number of traveling exhibits. They're made up of multiple banners, as you can see in sort of this in the bottom left right here. These are large 7-foot banners with graphics and information on a certain topic. All you have to do is pay for shipping, and you get to display it for 6 weeks. You can't really do that now, unfortunately, but hopefully if we ever get back to a state when we're able to visit with each other, this is something that will hopefully be an option for you. This particular website you can look up if you search for NLM traveling exhibits. And this particular exhibit is called Pick Your Poison. And it's all about the history of drugs. And it has some very interesting artifacts. So it has a physical, there's a physical component to it. But as you'll see on the next slide, there's also a digital exhibit where you can further explore this topic. One of the interesting artifacts here are the cocaine toothpaste drops for HUD screening system. Okay, more authoritative sites. This next site is not from the National Library of Medicine, but it's from the Drug Enforcement Agency. It's kind of fun to explore. You can find basic descriptions of many different types of misuse, many different types of drugs that are misused. You can also learn about associated paraphernalia, like delivery systems and the street names of drugs. It's hard to tell exactly where the site is from, this next site is from, but it's actually just the drug section of the Centers for Disease Control, or the CDC website. If you're needing to look up stats or find public health information for grant writing, or you're just a little bit more curious about this topic, this is where to go. There's a lot of great information, and some of the data that I have communicated during this presentation is from this site. Next, we have the National Institute on Drug Abuse. So this is an institute that's part of the National Institutes of Health. They also have lots of educational topics. They have clinical resources. They do a lot of research on drug abuse or drug misuse, and they offer also research and grant funding. I've mentioned this earlier in the presentation, so it's also a great resource if you're looking for data as well. And then there's the Substance Abuse and Mental Health Services Administration. Many of you may already be familiar with this. They have actually tons of resources, as you might be aware, and tons of programs. But a very specific resource that I wanted to point you toward is the Evidence-Based Practices Resource Center. So if you're looking for toolkits, if you're looking for data, if you're looking for treatment options, across a wide variety of different types of substances or for mental health, you can find it here. They also offer grants, data, training. They also have the National Suicide Prevention Hotline. Now, that's been in the news recently, actually. So this is also a great resource to explore. And again, some of the data from this presentation was from them. So that's actually a pretty good sample of a lot of the different authoritative resources that we have out there. But now I kind of want to switch topics. It's one thing to talk about the trends and statistics around opioid misuse. There are lots of resources that I hope that you all are able to share in whatever education or outreach programming you're doing, or whatever resource guides you're trying to put together. But I would like to hear about the outreach programming that you're interested in, or perhaps the questions you have around opioid misuse. So if you have any questions or if you have any ideas, I'd like to hear from you all first. I also have a couple of ideas on my own that you'll see on the next slide. So I'm going to give time to put things into the chat box. Or if you just have a comment about the presentation thus far itself, I would also like to hear from you. Or I guess I can ask a more targeted question as well. Has anyone ever conducted an outreach program to specifically address opioid misuse? Whether it's education or partnering up with local law enforcement or local community centers to do a drug take-back day. Or is anyone interested in doing something in the future? Great. I'm getting a couple comments coming in. Yes, we had NER, so that's the New England region. That's another RML funded a grant to purchase medication disposal bags in some large New England cities. Great, thank you for sharing that. My university has received a grant for training employees on the use of Narcan, and it was distributed to anyone who went to the training. That's great. No planned programming at the moment, but getting some ideas and useful information. Thank you. Let's see, question here. Can you recommend some good books to read to learn more about the opioid crisis? Yeah, I can recommend a couple books here. So there's a book here. I'm just going to go ahead and, I'm going to find it on Amazon and I'm going to paste it into the chat box here. So again, this isn't a promotion, or not official promotion at least. But there's a book called Painkiller, An Empire of Deceit and the Origin of America's Opioid Epidemic. Another one, hold on, let me try to get the Let me try to go to the paperback here, giving you the electronic version. Not that I have anything against that. This one was a National Book Critics Award. This is called Dreamland, The True Tale of America's Opioid Epidemic. I always like reading about the history of the opioid epidemic. I always find it funny that, when we talk about the three ways of any sort of drug epidemic, because, that timeline I showed everyone with the CDC starts in I think the beginning of the timeline was 1999. But, some may remember that Richard Nixon declared a war on drugs back in 1971. I mean, naloxone itself, or sorry, not naloxone, methadone has been available for 50 years. Well, almost 50 years. It was, I think it became approved for use for treatment in 1972. So I always like histories of opioids and drugs, which I think is pretty interesting. Okay, another comment here. We also partnered with Rotary Club to provide education about substance use disorder. So thank you for your comments. That's actually a very good segue because an audience that I've been working with lately, and I know other libraries have been working with lately, are parks. In fact, I just not too long ago, I gave a virtual presentation at a parks conference about this very topic. So this was in the National Recreation and Park Association magazine a couple of years ago. It talks about problems that even if you haven't seen them personally, although I have when I've worked in public libraries before, like discarded syringes, or the fact that library staff, or park staff have gotten naloxone training. This article, I encourage you to look it up at some point. It also describes a number of programs I thought were interesting. Programs like Parks After Dark that were specifically developed to help create safe environments for low-income communities, since opioid addiction is linked with socioeconomic disparities, social isolation, and trauma. And we all know that creating healthier alternatives can lead to better social networks. And so parks maybe more so than libraries, but I like to think that I felt this way as a librarian. When we do programming and we provide this education, we might not think of ourselves as health professionals or health information professionals. But from a certain point of view, we are on the front lines for preventative health with the community programs that we run and the partnerships that we make within the community. As part of a regional medical library, part of our task is to help improve health literacy. And so I'd be remiss if I didn't mention, I found this quote a while back. When looking at the indicators, and they're talking about here social determinants of health. When looking at indicators for preventing opioid use, misuse, and substance use disorder, the upstream intervention for each indicator come back to the same conditions for health: a livable wage, safe housing, quality education, affordable child care, health insurance coverage, social support, food security, and social cohesion. So this comes off of the Minnesota Department of Health website. So that's the last quote I want to leave you with. Even if you have not done too many programs around opioid misuse or to try to address opioid misuse, there are a lot of opportunities out there for that. The NNLM also provides funding every year, and as someone mentioned earlier, we have had grants in the past to address opioid misuse in some way. SCR actually just this past year funded a organization, Arkansas, to provide education to schools and older adults and others in the community around opioid misuse as well. So we definitely want to be a resource for you all. And if you're interested in learning about additional resources or additional funding, I encourage you to contact your local regional medical library. Thank you all for attending this presentation. I'm going to stop the recording now, but stick around because I just have a few more housekeeping items to wrap up before we end.